Zenpep is a medication that contains digestive enzymes to help break down and digest fats, starch, and proteins in food. It is used in conditions where the pancreas cannot make or does not release enough digestive enzymes into the small intestines to digest the food. These conditions include chronic pancreatitis, cystic fibrosis, cancer of the pancreas, post-pancreatectomy, and post-gastrointestinal bypass surgery. It is important to take Zenpep with every meal or snack, and the dosage will depend on the individual's specific needs. It is best to take Zenpep at the beginning of a meal or snack, or as directed by your doctor. If you've been prescribed Zenpep, it's important to take it with every meal or snack. You should swallow the capsule whole with plenty of fluids, and do not crush or chew the capsules. If you have trouble swallowing, you can open the capsule and mix the contents with a small amount of liquid or soft food that doesn't need to be chewed, like room temperature applesauce. Make sure not to mix it with alkaline foods or liquids, and swallow the mixture right away. It's important to take this medication regularly to get the most benefit from it. The dosage is based on your medical condition, diet, weight, and response to treatment, so be sure to follow your doctor's instructions. If your doctor has recommended a special diet, it's important to follow it to get the most benefit from this medication. It's also important not to change brands or dosage forms of pancrealipase without consulting your doctor or pharmacist, as different products may contain different amounts of the digestive enzymes. And finally, be sure to tell your doctor if your condition lasts or gets worse. Some common side effects of Zenpep may include diarrhea, constipation, headache, abdominal pain, cramps, bloating, gas, cough, nausea, or vomiting. If any of these effects persist or worsen, it's important to let your doctor or pharmacist know. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's important to contact your doctor right away if you experience any serious side effects, such as severe constipation, severe stomach or abdominal discomfort, frequent or painful urination, or joint pain. While a very serious allergic reaction to Zenpep is rare, it's essential to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as a rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects that are not listed here, it's important to contact your doctor or pharmacist. Remember to consult your doctor for medical advice about side effects, and you can also report any side effects to the FDA in the US or Health Canada in Canada. Before taking Zenpep, it's important to let your doctor know if you have any allergies to it, pork protein, or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's best to talk to your pharmacist for more information. Before using Zenpep, be sure to inform your doctor or pharmacist about your medical history, especially if you have had sudden and severe swelling of the pancreas, worsening of long-term pancreas disease, gout, kidney disease, high uric acid levels in the blood, or intestinal problems like blockage. If you have diabetes, Zenpep may affect your blood sugar levels. It's important to check your blood sugar regularly as directed and share the results with your doctor. Your doctor may need to adjust your diabetes medication, exercise program, or diet. Before having surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to use Zenpep only when clearly needed. Be sure to discuss the risks and benefits with your doctor. It's also unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. When taking Zenpep, it's important to be aware of potential drug interactions. These interactions can affect how your medications work or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. This will help them determine if there are any potential interactions with Zenpep. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Zenpep include acarbose and miglitol. It's important to discuss any concerns about potential drug interactions with your healthcare provider. Additionally, it's important to follow the prescribed daily dosage and take Zenpep at the optimal timing recommended by your doctor for the best results. If you suspect an overdose or serious symptoms such as passing out or trouble breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. For Canadian residents, you can call a provincial poison control center for assistance. Zenpep is a medication used to help people who have trouble digesting food because their pancreas does not make enough enzymes. It is taken with every meal and snack to help break down food into nutrients that the body can absorb. The dosage is based on the patient's condition and response to treatment. It's important to take Zenpep exactly as prescribed by your doctor. Remember not to share this medication with others, as it may not be suitable for their condition. If you forget to take a dose of Zenpep, just take the next dose with your next meal or snack as directed. Don't take extra doses to make up for the missed one. When it comes to storing Zenpep, it's important to keep it at room temperature, away from light and moisture. Make sure to check the product package for specific storage instructions, or ask your pharmacist for guidance. It's important to keep all medications out of reach of children and pets, and never store them in the bathroom. When it comes to disposing of Zenpep, it's crucial not to flush it down the toilet or pour it into a drain unless instructed to do so. Be sure to properly discard the product and it's expired or no longer needed, and consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.